Hi, my name is Shelby, and I'm going to be presenting over my personal illness story. So, I'm doing my illness story over polycystic ovarian syndrome, or PCOS. Um, Basically, PCOS is a hormonal disorder that makes it really difficult to get pregnant. It causes the ovaries to become enlarged, and as you can see in this picture on the right side, small cysts also gather around the outer edges. So, the key people in my illness story are my husband, my parents, my OB nurse, and Dr. Reshef, who is the specialist that we ended up seeing later on in the story. Okay, so my journey to diagnosis, I'll go ahead and start with the signs and symptoms. So, how this all started is actually kind of funny because it all started a little over a year ago when I started watching a YouTube family who daily vlogs. This couple had been struggling for years to get pregnant because the wife has PCOS. I found a video that she did where she talked about what it's like to have PCOS in terms of the symptoms. She talked about how she would go months without having a menstrual cycle. And at the time, this caught my attention because I had struggled with that ever since I started having menstrual cycles. I know, TMI. When I was living at home, I had mentioned to my mom that I had irregular periods, but she said it was probably just because I was so active. And I was active. I'd played soccer ever since I was 5 years old, and I was on my high school team and on a club team, so I was extremely active. But long story short, after hearing this woman talk about it, I got this feeling in my gut that I had the same thing. And I told my mom my concern about having this, and she was like, no, 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 you're fine. Nothing's wrong with you. But I still couldn't shake the feeling that no, something was wrong with me. So I went to my OB for a checkup and to let them know that my husband and I were wanting to start trying to have babies soon. And after discussing my concerns with my OB nurse, they decided to schedule me for an ultrasound on my ovaries. So I went in for the ultrasound, and a few days after my appointment, they called me with the results. And this is where I get to location. I was at a park doing a workout with my best friend when they called me, and it was the OB nurse who told me that I did have PCOS on both of my ovaries. And my personal reaction to this was, okay, I have PCOS, now what? And then after that, it was kind of like this fear set in. This fear of, well, is it going to take me years to get pregnant? Will I ever be able to get pregnant? It was just this uncertainty that kind of overwhelmed me a little. So, the treatment that I ended up doing over the year that we struggled um, was at my OB, they put me on a medication called Clomid or clomiphene, and this helps with increasing your estrogen because PCOS basically the testosterone levels within you are higher than estrogen, and so to counteract that, they give you Clomid to increase your estrogen. And so I did that for 3 months, which is why it says 3 cycles. That's what it means. And the side effects with Clomid were not very nice. First, they made me crazy, hormonally and emotionally. I would cry at the drop of a hat. And also, they caused me a lot of pain. I had lots of pains and nausea and things like that. But I think the worst symptom was that uh, the symptoms were really similar to pregnancy. And so my first time on Clomid, I thought, oh my gosh, it worked. I got pregnant. When actually it was just the medication. and I ended up having to do 2 more cycles of that. And then after the third cycle, when it didn't work, they said, we have to send you to a specialist now, because Clomid is such a strong drug that it's not healthy to be on it for long periods of time. So they only do 3 cycles and then they send you to a specialist. So they sent me to Dr. Reshef, and it actually took a couple of months to get into his office. So I went a couple of months without any medication, and without any way of trying to get pregnant other than just naturally hoping that it would happen, which it didn't. So we went and saw Dr. Chef, and I did 2 cycles of Femara, or letrozole, and he actually upped my dosage the second time. And the side effects with Femara were not nearly as bad at all. But after going to the specialist and after going to him for the 2 cycles, he kept saying at my ultrasounds that my ovaries looked fine and that I didn't have any cysts and that everything looked good and healthy. And that was really confusing to me. And so I spoke with him about it, and he told me that he didn't think I had PCOS. And obviously, that was a shock and kind of a relief at the same time, but also kind of confusing because one doctor told me that I did, and now I have this other doctor that's telling me, no, everything looks great. And if that's the case, then I was sitting there wondering, well, then why is it so hard for me to get pregnant? But basically, he told me that I didn't have enough of the symptoms to be diagnosed with PCOS. I did have the really irregular periods, but I didn't have excessive hair growth or excessive weight gain or any of the other symptoms. And so he said, basically, your main struggle is not being able to ovulate. And that meant that I had unexplained infertility. I wasn't sure if I should feel happy about that or mad that one doctor told me I had something when I didn't, or that I had cysts at the ultrasound and they just went away on their own. I wasn't sure what to think at all. And so I'll go ahead and move on to the biopsychosocial spiritual impact that the treatment had on me, and this experience. Basically, biologically, it was hard on me. It was hard on my body, especially the Clomid. As I said, the symptoms were not very nice. So I struggled with a lot of pain and nausea and headaches and things like that. And psychologically, it also wasn't very nice. It messed with my head. I thought that I was pregnant several times, just to find out that I wasn't. And so that was a struggle for me. And it made me feel kind of hopeless at times and sad and frustrated, all of the above. Socially, I withdrew a little, but I had my parents and my husband there, who supported me and were there every step of the way. I could always talk to them about my frustrations or my fears or what I was going through, and they were always there to just listen and to encourage me and to support me. So I had a really great social support in them, and also in my church. I did tell my pastor and my worship leader what we were kind of struggling with, and so they were also huge in my social support and praying for me and things like that. Which brings me to spiritual. The spiritual played a huge role in all of this, because every time that I found out the medication didn't work, my first thought was obviously sad and disappointed, but my second thought was, well, there's got to be a reason. There's a reason why I'm not pregnant right now, and it's because God's timing is perfect, and it's just, it's not my time to be pregnant. And that helped me get through, even though I did still struggle, that ultimately helped me to kind of get through. Which brings me to strengths and perseverance. So even though it was hard, I think my spirituality um, enabled me to persevere through the entire experience. And then family support. I know this isn't a personal strength, but um, I think it displays a strength that my family has, because they were all there for me, even extended family, through prayer, through encouragement, through text messages, through giving me advice about, well, not even advice, but just information on things that I could do if this medication didn't work, especially my dad. He was always looking up things and calling me and saying, "Hey, I found this new treatment that could help," and he was just really involved in that, and they were just a huge support. And then my spirituality. Obviously, I've mentioned this several times, but that was one of my biggest strengths, was just being able to lean on God. And I also kind of used a song by Hillary Scott called "Thy Will," which is a song that she wrote about her miscarriage. And every time I was feeling hopeless or helpless or sad or angry or frustrated, I would listen to that song, and it really helped me a lot. Obviously, it wasn't all butterflies and rainbows, though. It wasn't just all these strengths that emerged, there were also challenges. So, staying hopeful was definitely a challenge. And as I said in the last uh, slide, my spirituality and that song that I would listen to really helped in that, and my encouragement from my family. Um, and then being happy for others was also a challenge. In particular, being happy for other people who were becoming pregnant. And I really wish that it wasn't so hard for me to be happy for them, but it was. Mostly because of the jealousy, of why are they getting pregnant and I'm not? Why is it so easy for them and so difficult for me? Um, and obviously, that kind of brought about some anger and some sadness. But the illness played a role in my life. And, the beginning, this was over PCOS. And even though I may or may not have it, there was still something going on, unexplained or not. I still had something that was wrong, and it played a role in my life, a big role, especially through my thought processes. So, just thinking about children, thinking about babies, thinking about parenthood, um, thinking about all of those things, um, they were kind of painted differently now going through this. My daily activities. So, I mean, I was having to do lots of things. I was having to take medication. I was having to keep an eye out on my temperature. I was having to track my ovulation. I was having to do a lot of things on a daily basis that I normally didn't have to do. And so the illness definitely played a role in those daily activities. And then in my communication. So, my communication with my husband about children and about um, just on a daily basis, we talked about um, the illness and about the medication and about what we could do if it didn't work and things like that. And so it definitely played a huge role in all of those areas. So my biases and beliefs. I think that my biases against, or I guess with this illness, is that I feel like when you struggle with infertility, it makes you more grateful. And I hate saying that because I don't know if I can even say that because I know everybody's grateful for their children, but I think that you have a new appreciation for just the entire experience of pregnancy and giving birth, and having that child that you've been waiting for so long. Um, and then medicine. After this experience, I believe that medicine equals results. You just have to find the right type and the right dosage, because that's what happened for me. So after I found the right type, which was Femera, and then the higher dosage, I was able to get pregnant. And then I also, after this experience, believe that the medical community wants to help people. I know that a lot of people, their experience with doctors isn't that good, but fortunately, my experience with all of my doctors were really great. Even though there was that confusion about do I have PCOS, do I not? I could tell that no matter where I was. So at my OB office, um, they were really concerned about getting me what I needed. And I could just tell that they really wanted to get me where I wanted to be. They wanted to get me pregnant. And the same with my specialist. He was working really hard in order to figure out what was going on and what we could do. And so I think after this experience, I definitely have a bias and a belief that the medical community, all in all, just wants to help people. And I don't necessarily think that that's a bias, because I think that, all in all, most medical professionals do want to help people. But I do know that people have struggled with medical professionals as well. So I want to be mindful of that. MedFT involvement. So I think that if a medical family therapist was involved, they probably could have helped me with some coping. I had some pretty good coping skills by just listening to songs and being able to pray and things like that. But just some other coping skills about helping with maybe some jealousy and anger and things like that. And then helping communication between my husband and I, because even though he was really supportive and all in all the experience was really good between us, there were times where we struggled um, with communication. And then I think that a MedFT could have really helped to process my feelings about the entire thing. I don't think I ever really got to process all my feelings. It just kind of happened, and I got through it. But I definitely think that my journey may have been easier. I don't know if anything would be different now if a MedFT had been involved, but I definitely think that the journey would have been different and definitely easier if a MedFT was involved. And lastly, I will end with my summary and conclusions. So, preparing this presentation was extremely empowering and encouraging. Um, it kind of reminded me of all the things that I went through and that I got through. The things that I realized about myself through this was that I don't give up easy. I try to stay positive, even though it was a challenge at times. I really did try to stay positive, and that I couldn't have done it without my husband. I know that's not really something about myself. Well, I guess it is. But I definitely couldn't have done it without my husband. He kept me strong. And then my approach with similar clients, I feel like I would be able to have a general understanding of kind of what they're going through, even though I know their experience would be different. We have a similar understanding, and I think that that would be able to bond my client and me in a therapeutic relationship. And I would also have knowledge about the disorder, the treatment, references, and ways to cope. So that is my presentation. Thank you.